Hello, Mr. Jones.
All right.
My name's Hugo Henderson.
Yep.
I'm going to be your physiotherapist for the day.
That's it.
Nice to meet you too. How's your day been?
Yeah, pretty good. Yeah.
Perfect, perfect. Would you mind taking a seat? I understand your shoulder's in a sling. Just
Yeah.
take a seat. You're right there?
Yep.
Perfect. All right. Mr. Jones, before we start off with the physical assessment, I just want to conduct a subjective assessment on you, which is going to require me asking you a few questions about yourself and your health. Would that be okay?
Yeah, sure. Go for it.
Perfect, perfect. So firstly, to begin, what's brought you here today?
Well, see, I had a stroke a couple of weeks ago.
By a couple of weeks ago,
I'd say probably about 2 weeks and 2 days.
2 weeks, 2 days ago?
Yeah.
Yep. And what were you doing when this stroke happened?
I was having a beer with just after work, and yeah, started to feel a bit off. I don't think I was drunk, but yeah, I just decided to go back home, just have a rest. But yeah, pretty much by the time I got back home, yeah, I was feeling sort of lightheaded and dizzy. I just fainted, you know.
You fainted, right?
Yeah.
Right, and do you remember waking up from fainting?
Yeah, so basically when I woke up, my whole left arm and left leg were just, yeah, they just couldn't move. Like,
The whole left side of that body?
yeah. And like, yeah, I couldn't really talk properly either. So
By talking properly, was your speech a bit mumbled, a bit...
yeah, it was just like a bit garbled, couldn't really articulate properly.
Right.
Yeah, wasn't sure why.
Right, so it was that left-hand side of the body and your speech.
Yeah.
Well, bear in mind that is quite a common thing to happen in stroke patients, which
Sure.
you've come in here with today.
Yeah.
If you fainted, when you woke up,
Yep.
could I ask, did you get yourself to the hospital,
Well, yeah, so funny story. I was just like screaming out for help because basically, obviously, I can't move. So, and yeah, my neighbor Joe, he heard me. So, and he ran over and called the ambulance for me.
Really? So Joe heard you, your neighbour heard you crying out for help,
Yeah.
even though you were mumbled words,
Yeah.
and he was able to call the ambulance and get you there.
Managed to make enough sound.
Perfect. I'm glad you could, and once again, I'm really glad that
Yeah.
Joe was there.
Yeah.
Perfect. All right. Now, Mr. Jones, I've read your referral. I've had a good look over it, and I see that you've been in the hospital rehabilitation ward for about 2 weeks now. But just as of the other day, you seem to have discharged yourself. I just want to ask, was everything all right there? Did you just discharge yourself for a specific
Yeah.
region?
Yeah, well, yeah, pretty much had to go home to take care of my dog, Bluey.
Right.
Yeah,
You're a dog
so,
man.
yeah, yeah, he's a good boy. He's a cattle dog.
Oh, really?
Yeah, he's 8 years old. Yeah.
Ah, no way. I've got a Labrador who's 8 years old.
Oh yeah.
Yeah,
How old is he?
8 years old.
Ah, same. Nice.
Yeah, I know, it's cool.
Can we be friends afterwards?
He's not too good with some other dogs, but we'll see how he
Really?
goes.
Oh,
Yeah, it's a
yeah.
bit annoying. I always want to take him to the dog park, and he just goes crazy at the
Yeah,
dogs.
some dogs are like that.
I know. Anyway, so in regards to your whole experience then at the hospital, how did you find it?
Everything was fine. Yeah, like all the doctors, nurses, physios, they were great.
Yeah?
Yeah, they were really friendly.
All right, well, I'm glad to hear that.
Yeah.
Well, have you experienced a stroke or anything of the sort before, Mr. Jones?
Well, not really, but yeah, I have had, like high blood pressure and high cholesterol.
Right, so high blood pressure, high cholesterol,
Yeah.
and you said not really. Is it just not really or no? Or
Yeah, I just didn't have any strokes in the past. No.
Right, perfect. Moving on, obviously I've seen you've come in today with your 4-pronged walking stick and your arms clearly in a sling. Is this due to pain?
Yeah, well, pretty much. But like, yeah, my shoulder's in a lot of pain. And so is my hand.
Your shoulder, could you just pinpoint where on your shoulder?
It's
Roundabout?
just around here.
Down in that right tip?
Yeah.
Yep.
Yeah, and just you can see it's pretty swollen. the
Perfect. Yes,
Yeah.
it's quite swollen around that wrist and that hand area.
yeah.
And you got any pain in your leg?
Not really. It's not
Okay.
really painful, but it
Mhm.
just feels really weak.
Mhm.
Yeah, I can't really do much with it.
Right.
Yeah, that's hence the walking stick.
Yeah, of course. So the pain really is coming from your hand, your wrist, and your shoulder.
Yeah, basically.
Okay.
Yeah.
And are you able to maybe rate this pain for those things out of 10, with 1 being not very painful and 10 being absolutely excruciating, starting with
Sure.
your shoulder?
Yeah, I'd say shoulder would probably be about 2 out of 10 normally.
Is that ache, sharp,
It's just like a dull, achy pain
dull ache?
in the background.
Yeah.
Yeah. But yeah, sometimes when I'm walking around the house just doing stuff, and my arm gets caught in stuff, and
Mm-hmm.
my shoulder twists, and yeah, it just ramps up to like a
Quite painful.
8 out of 10.
Mm.
Yeah, gets pretty bad.
Right,
And-
yes, as soon as any movement in that joint, that shoulder joint, it really ramps up the pain.
It does.
And when it goes up to an 8, how long does it stay there for?
Probably about, I'd say, 15 minutes or so.
And then it drops back down to normal?
to 2,
Yep.
2 out of 10 maybe.
2 and 2?
Yeah.
Right, and your wrist and hand?
I'd say probably about 6 out of 10.
6. And also like an achy,
This,
welling pain?
yeah, would be a bit of a achy.
Alright, no
achy
worries.
thing. Yeah.
No worries. And over the course of the day, how's this pain? Does it change? Does it vary?
This sort of, it stays the same relatively until I go to bed at night. Yeah, especially when I turn it on my side, on my left side, and
Right.
just all like the pressure just makes it really painful.
So the pain really is exacerbated at night time.
It does. Yeah.
Right. Is it keeping you up at night?
Yeah, so pretty much I wake up like 6 times a night, I'd say.
Due to pain?
Yeah, just because of the pain. It gets so painful, and yeah, like I just stay up for half an hour because of it. Just because
Each time?
yeah, each time I wake up, yeah, just because it's so painful and
Oh,
just
Mr.
can't go back
Jones.
to bed.
That must be terrible. You must be exhausted, you poor thing.
Yeah,
Are you finding you're quite exhausted?
I am. Yeah,
Well, you're waking up 6 times a night, and each time it's taking about half an hour for the pain to go away or for you to go back to sleep, you're saying.
can't really get a good sleep.
You poor thing, mate. Moving on there, I must completely understand that at night time, pain really ramps up. Is there anything that you do in general daily life that really aggravates the pain?
Well, I guess just usual, normal stuff like, putting on my clothes,
Getting
yeah,
dressed?
going to the toilet, I guess,
Mhm.
driving,
Mm-hmm.
and yeah, just rolling on my side as well.
Right. So obviously, whenever you put some pressure on that shoulder,
Yeah, basically.
when you're driving or when you're dressing, when you're really having to do movements that activate that shoulder.
Basically, yeah.
Right. And to ease the pain, is there anything you're doing?
Yeah, well, not really. Like, it's sort of, well, I'm not sure what you mean, like, in terms of...
So what I mean by that, what tends to ease the pain?
Right. Well, yeah, I'd say, just leaving it to rest for
Mm-hmm.
a long while. Yeah.
Rest helps ease the pain.
Yeah, just not doing much with it.
Mm-hmm.
And, yeah, just take a few pills of Panadol every day.
A few pills of Panadol, so around
Yeah.
3 things of Panadol,
Yeah, I'd say 3 to 4.
3 to 4 a day.
Yeah.
Mm-hmm.
And, just good old alcohol.
Some alcohol.
Yeah.
Any particular alcohol?
Just Hennessy.
Hennessy, the fine stuff for you, Mr.
Yeah.
Jones. The whiskey, I see.
Yeah.
Right. And can I ask how much whiskey you were having?
Probably about, 2 to 3 glasses some nights.
2 to 3 glasses?
A few nights a week.
A few nights a week.
Yeah.
All right, perfect. And now, I now just want to delve a bit more into your family history and your personal history and life, just so I can get a bit of a greater understanding and a broader spectrum. It will really help me understand the condition. So, has your family had any history with stroke?
I don't believe so. Like, my dad did have a heart attack and he died because of that. And
How old was he, may I ask?
around 60 years old.
Mm-hmm.
Yeah, and my grandparents died pretty young as well.
Mm-hmm.
Not sure why, but yeah. My mum, she died in a nursing home,
Mhm.
just due to old age, basically. Yeah,
Right.
and I've got a brother as well. He, yeah, I'm not sure with him. Haven't really been keeping touch with him.
Yep. Okay.
Yeah.
Understand. So yeah, it seems to me there's no family history of stroke.
Yeah.
And now moving on to yourself. What are some of your hobbies or interests that you like to do?
Oh, yeah, I do. Normally, like, go to the pub, few
Mhm.
mates.
Yeah.
Watch a few games of footy
Mm-hmm.
with mates, and yeah, I'm a pretty good pool player myself.
Oh, really?
Yeah.
I'm a shocking bull player.
Is it?
Yeah. You said watch a bit of footy. Who's your team?
Hawthorn.
Hawthorn?
Yeah.
Geez, they've been got strong over the last few years. Wish
Yeah,
my team was
yeah.
like that.
Had a few championships. Yeah.
Unlike mine, Brisbane Lions.
Oh,
I think we've been the wooden spoons for the last 5 years
Yeah.
or something.
Guy on the down end.
Yeah, I tell you what. And these hobbies and interests, you still doing them?
Well, can't really do much these days with them. So yeah, just been sort of avoiding.
Avoiding. Is that because of the pain?
Well, partly, but not really. Just it's mostly just because I feel uncomfortable just
Mhm.
socializing with people with this current state. You know,
Mm-hmm.
Yeah.
And Mr. Jones, what do you do for work? Or do you work or did you work before?
I was working as a builder before this.
Yep.
Just building with residential housing.
Yep.
And, yeah, that sort of stuff.
Perfect. So been on the tools for a while?
Yeah, probably about I'd say 30 years or so now.
And I don't know how you do it.
Been
Incredible.
at it for a while.
And now just moving on to your home situation. Could you tell me about, do you live alone or with someone?
I'm living alone, but
You live alone?
with Bluey.
With,
yeah.
of course, with
Yeah.
Bluey. And class whereabouts? Or apartment, house?
It's just in this this community housing.
Mm-hmm.
It's just one story,
One story?
and yeah, just yeah. It's recently in the last 2 weeks, my OT helped organize a few railings to be set up in the house.
Oh, perfect.
Yeah,
Perfect. Have you found that's been helping you?
it has. Yeah,
I'm
So,
glad to hear. I'm
just
glad.
going to the toilet, or just doing stuff without the walking stick.
Perfect, yeah.
It's been helpful.
Is there much maintenance to your house that's required to be done by you?
Not well, yeah. Mostly just the front lawn.
Mhm.
Yeah, just trimming the
Mhm.
grass. Yeah, and yeah. Well, mostly that and just cooking, I guess.
Yeah.
Yeah.
Perfect. No, everyday chores, living.
Yeah.
Things nice. All right. Are you taking any medication?
I am taking a aspirin,
Mhm.
apart from the Panadol,
Mhm.
and Lipitor,
Mm-hmm.
and I think Coversil.
Mm-hmm.
Yeah.
Aspirin, Lipitor, and Coversil.
Yep.
Taking them once a day.
Yeah, pretty much.
Once a day, pretty much.
Yep.
All right. So that is a yes.
Yes.
All right. Have you had any surgery recently?
No.
No. Have you had any tests or investigations done on your health recently?
No, I haven't.
No. Have you noticed any change in your weight in recent months?
Not that I've noticed.
No.
No.
And this is a bit of a personal question, but it really does help us understand our patient's health.
Yeah.
How's your bladder and bowel movements at the moment? Has it changed or is it still the same?
It's working fine as far as I know.
Working fine, no worries. All right, so that sort of finishes up what I want to ask you, the questions. And I guess the final thing I want to see is, because we're here for you to help you get better, help you especially help this left side of your body
Mhm.
get better. What are your goals for physiotherapy, Mr. Jones?
Well, I'd say, just getting back to work,
Get back to work,
getting rid of this stupid shoulder pain,
no pain.
being able to walk again, I guess, and yeah, just taking care of home stuff
Mhm.
just by myself.
Maintenance.
Yeah, just being able to have a good rest at night,
Of course.
Yeah.
Oh, yeah, we all need a good night's rest.
Yeah.
So it's that good night's rest, that independence, maintenance of your home,
Yeah.
and no pain.
Yeah, all that, pretty much.
Perfect. We're going to do our best as we can to get you to achieve your goals, Mr. Jones.
Awesome.
Perfect. Well, thank you again for that. And now what I want to do is I just want to take you through, do some physical assessment on you.
Yeah, sure.
You can just stay there because I understand your arms in the cast and your wheelchair's over there. Your walker, I should say.
Yeah.
Perfect. I'll be with you in just a moment.
Awesome.
Thank you again.
Thank you.